close enough. I think we could start anytime.
Okay. All right. Well, Linda, tell us about the Shawnee County Health Department.
Well, good morning, Commissioners. Linda Oaks from the Health Department. Yes, we are here to go over our 2021 budget request from the Health Department. And here you see our mission and vision statement, and those have remained the same this year. We did not update those. I do have with me Edith Gaines, who's our Chief Financial Officer, and she's Division Manager over Administrative Services. Nancy Mitchell's on her way. She must have gotten delayed, but she's also coming too. She's our accountant and has put the budget together. So I'm going to briefly go over the Health Department and the functions. I'm going to just do a high overview of it, and then feel free to ask questions as we go. This is our current organizational chart. We're going to have a change in that. We're going to be adding the infectious disease division here pretty soon. So I did not have time to update it, but that is going to happen. So next year it'll have one more box on it. What happened to my... I lost a slide, my strategic plan slides. So I'll just go over the divisions that we have briefly and what they cover. First, the Financial Administrative Division, and that is Edith's division. There's 10 FTEs in that division. We do budgets, purchasing, and they also handle a lot of other things in the Health Department that we need to handle, just because they're very good at this. There's Nancy, she made it. That's all right. I do want to wish Nancy a very happy birthday today, too. Today is her birthday.
Happy birthday.
So they handle risk management, our quality improvement. Edith was our accreditation lead, and then the electronic medical record. And so there's a lot that happens in that area besides just budgeting and purchasing. But purchasing is also a really big thing right now with everything that's going on with COVID. Then we have the Family Health Division. What other presentations do you get to see a cute baby? And this is one of our clients. This is a real cute baby from Shawnee County. So Family Health Division has 28.35 FTEs. It's the Nurse Family Partnership, the WIC program, First Steps, which is our social work program for families that are at high risk and need support, but don't fit into the categories of the evidence-based programs such as Nurse Family Partnership or Kansas Children's Service League program. And then the Baby Basics class, our prenatal training, which I believe is still on track to be done this fall virtually. So we're going to have that, and we also still have the incentives that we get from our grant money, such as Safe Sleep, Pack and Plays, car seats, other things that we do give to the participants. So that's a big division now. Then we have clinical services. These are the folks that are calling everyone right now to tell them about COVID-19, that they're positive, what they need to do. These are folks that are working so many hours. There's 12 and a half FTEs in this area. It contains our STD clinic, our immunization program, of course, communicable diseases, and then family planning. That's that group. Then health protection, which is our environmental health program. There's 9 FTEs, and that includes environmental health, which do the septic licenses, the nuisance complaints, the mosquito trapping, any other issues with the environment in the county, and then child care licensing. And of course, that's a Kansas Department of Health and Environment regulated program, but those folks are the ones that go out and do the inspections and handle complaints with the child care licensing and child care centers. They also investigate illegal child care in Shawnee County, and that's all of Topeka and Shawnee County. And then community health outreach and planning. This is 7.5 FTEs, so this is where we have epidemiology. We have our community planner in this area, our emergency preparedness and medical reserve corps, health promotion, and public information. So this is some of the things that they've been working on, smoke-free housing, and then of course they do a lot of education, and they're getting ready to do some mask education. We're going to get some stuff out about proper mask wear and where to get masks and that sort of thing. So there's our strategic plan, and we did kind of take the strategic plan and we did a thorough gutting of it and re-looking at our whole strategies and designing it, putting more strategies in, and unfortunately we haven't been able to touch it this year. That is the sad thing. So my plan is to keep the strategic plan pretty much for next year and try again. So, but as you can see, we have really tried to expand in the area of health equity, trying to look at disparities in health around the community, and of course optimize strategies to get the community engaged in these activities. We know that we can't do it alone. So there is a lot of work that can happen in this area and needs to happen, was happening until the pandemic hit. So I have high hopes that it's going to be better next year and that we can tackle some of these areas. So that is my brief, high overview of the health department. Do you have any questions before I move into accomplishments for the last year?
Linda, you also have a lot of volunteers that work with the health department that aren't employees. Approximately how many, what's your volunteer base look like?
Oh, gosh, I'm going to have to get back to you on that. I don't know. It's a lot because of COVID. We had a lot of people come forward and volunteer. And does anybody have any idea?
I mean,
No.
just even, 20, 30?
Oh,
40?
50, 75, I would guess.
Okay.
Yeah, there's a lot.
And then these are all people that just volunteer their time to help out?
They are. Actually, we have a volunteer coordinator that emergency management brought on as an intermittent employee, and she's the one who oversees all of them. But we have a lot of them doing contact tracing, helping at the testing sites.
And is that Sky?
No,
Oh,
that's Carolyn Ward.
Okay,
Yeah.
okay, yeah.
Sky actually is Dusty's assistant, so that's her job with that. And then the phone bank, which I think has been blowing up this morning because of yesterday's order and lots of questions. So a lot of people call and ask questions about the orders, about, I got a positive test, what do I do? So we're handling a lot of those kind of questions in that phone bank. So, and making appointments for testing.
And then, just as an aside, while COVID has sucked the air out of almost every project that we have in Shawnee County, where do we stand on our strategic plan as far as our continuation of the community health improvement plan and addressing some of those things? I know we've got up there health equity and talking about community engagement, which are kind of the two key parts. Not that organizational excellence isn't important, but the health equity and community engagement was a key part of our prior plan when it came to addressing some of the deficiencies in the Kansas State rankings and the community health plan. Are we just putting all of that on hold, and has everything just been sidelined while we're dealing with COVID?
Not everything. Heartland Healthy Neighborhoods is still functioning. They lost their chair. She actually lost her position with her employer, so I think they're looking, the vice chair stepped up, who's Brett Martin with the United Way. So as soon as Susan can turn most of her work over to Kansas Health Institute, she will shift back into her work with Heartland Healthy Neighborhoods and start back on those things. And I do believe HHN did receive the Pathways grant from Blue Cross and Blue Shield, and I don't know if that's public yet, but I probably just spilled the beans. So they're going to be working on that too.
I think the
So.
tens of people that are watching will report it.
Tens of people, yeah. Maybe a 15, who knows? So, any other questions about, we're going to get back to this, Commissioner. I'm committed to this. We all are. We're committed to the health of our community, and it's very frustrating to all of us that we've had to stop everything to work on COVID. It's
And
not what we want to be doing.
I think that's critical. I mean, while our COVID has our attention and should have our attention right now, it's important for us not to lose focus on the overall improvement of public health in Shawnee County.
Absolutely, absolutely. So, okay. Any other questions about the department? And okay.
Just a question about
Yes, sir.
retaining staff and recruitment. Have we been able to fill all the lanes pretty much? I know we have one position here that we're going to be dealing with Monday or Thursday, but
Yeah.
So you want
Yes and no. It took us a year and a half to find an RN for the nurse funding partnership, but we just job offered for that. So that's the record. I think the last record took us a year to find a dietitian several years ago. So it just depends on the position and what the demand is. I think it's always going to be hard for us to fill positions. I do hope, and I know the salary study and discussion got put on hold, but I do hope we can address that again because I do think salaries are an issue with recruiting. We used to be able to say, yeah, just Monday through Friday, holidays off. Well, I can't even really say that right now. So, but we will be back to that. So we do have, and then the great benefits for the county. So we do have some selling points, and I think that'll help us, you know. Yeah.
how about your facilities? Do you feel like they're good and adequate for what you do, or?
Right now, they are. It's going to depend, I think, on whether we're going to be doing more, distance work. If we're going to be working, virtually at home. And I think with the infectious disease division, they can do most of that off-site. They don't need to be in the building, which is great, because that'll help us. JP Lewis is pretty full. Of course, I can't bring everybody in at once because I can't social distance them.
You
Yes?
might want to mention the building.
The building, yeah, and we are looking at a building to rent for a year, and I emailed you about that. There's some HUD money that we're going to receive through the city to pay for that, and so we can put staff in that building too, and that's where I was thinking about staffing the infectious disease division for now, until we can do something else. The folks at the North Annex are super crowded, and I cannot bring them in all at once. That is an issue, and I still have a supervisor without an office. So we do still have some issues with space.
The building that she mentioned at 29th and California would be paid for by the city's HUD grant, and that is on their agenda for tonight. Linda and I will be on their Zoom meeting in case they have questions. So it's on there for discussion this week and then approval next week. So hopefully that will be approved and that grant will pay for the rent.
Is
And they'll
that
pay
that-
for a year.
Is that savings and loan bank or whatever?
Yeah.
Caboose.
Whatever, the caboose, yeah.
Caboose Bank.
It's caboose still there?
It's actually an office
It's,
in the, it's,
yeah, it's
yeah, it's,
actually-
when you go in the building, it's all open and there's an office with quite a chandelier in it.
yeah.
All right?
But that's I really appreciate the city reaching out to us on that HUD grant that yeah, nice problem to have. They received more than they could spend.
And that money has to be used for testing
And
too,
yes,
so.
it has to be
and
used for certain items.
Let's not duplicate efforts, right? We're already
Yes.
testing. We can expand our testing, so that just makes sense.
All right,
Anything else?
guess not, no?
All right. You'll see this again. Maybe we'll get to work on it next year. That's my hope. All right, accomplishments. So we did complete the Community Health Improvement Plan over the last year. It's out. It's got measurable objectives. And so as soon as we can get folks back to work on that, we're going to be able to give you, the plan was to bring you quarterly updates and have a dashboard that we could show progress on it. That's still the plan. We just delayed. So I'm really excited about this Community Health Improvement Plan because it does have some nice measurable objectives in it. We had a good plan last time. We just were not as strong in the reporting out. So hopefully we've improved that this time. So that's coming. And then our PHAB accreditation site visit happened February 19th through 20th. Thank goodness we got that in before this all hit, because Wyandotte County got theirs canceled and they're still waiting. So if you can imagine working a year on all the documents we did and then have to resurrect them 6 months, a year later, I don't remember that stuff that long. I mean, it would have been very difficult. So, but they did postpone decisions for 90 days. So we should hear in September if we are to be accredited or if they're going to put us on an improvement plan, whatever their plan is. But I thought the visit went great. Commissioner Cook, they commented what an outstanding job he did. They talked to a lot of, he did, don't let him fool you. They talked to a lot of governing entities, and they thought that he did really well. So I think we're going to get it, but I'm just very impatient to get the word, get us accredited. I think it would help morale tremendously, too. So that happened. That's really the accomplishments, and that we're still all here and still kicking through all this, I would say, is an accomplishment. We haven't lost anyone yet, really, to the virus, but I do have people starting to talk about retiring soon. So we are going to have some staff turnover here pretty soon. So that's our accomplishments this year. I hope there's a lot more next year. So let's talk about our budget. We have a few new positions in our budget. This is not really new. We had it in last year, but we were just getting ready to start working on it, Tim and I, and then COVID hit. So the idea was to share a grant writer between the two departments to look at opportunities for working collaborative on projects that would fit both Parks and Rec and the Health Department. It's such a natural partnership. And so, and of course, my favorite example is our signs with the maps. They're still up. They look great. More things like that, more projects, more opportunities to help people get out and exercise. And so we pass on a lot of grant money because we don't have people to write the grants and to oversee them. So, and I know Parks and Rec is kind of in the same boat. So I would hope that we could maybe move forward on this one. in the next year, so we left it in our budget for this time. A family health administrative assistant. So Teresa Fisher is the division manager over this program. As I said, there's a lot of FTEs in that program. She deals with crazy grants and contracts, and you've seen them, Medicaid match, the Children's Cabinet, the MCH grant, partnerships with TARC. It goes on, and Nancy could also attest to that. There's a lot of contract work, and so she really does need some more assistance with some of the administrative duties that she has to do. They have a lot of grant reporting. It's just a big division, and so she does need that clerical, that higher level clerical help. So that's the slide from before, but yeah, a lot of FTEs in that department, so a lot of people. She does have 4 team leaders, sorry, 4 with WIC, but still, lots of folks. And then the infectious disease division, which I've talked to you about, this is the new division that we would like to add into our budget next year to handle COVID, all things COVID, testing, contact tracing, vaccination when it comes. And I think I've given this example. When we had H1N1 vaccines, I spent 6 months, that's all I did, was deal with vaccination, deal with inventory, with getting it out to providers, which making sure it reconciled, getting the vaccine to the pods. There's a lot of work that goes into it. And so we're going to need extra help with that too. And so these are my viruses that I like. So you can see the COVID virus, you probably recognize that. The blue one is measles. It looks a lot like COVID, doesn't it? I thought that was very interesting. We were always afraid of a measles outbreak. We thought that would be the worst. Yeah, well, it wouldn't be anymore, but we thought so. And then Shigella is the other bacteria that you see up there. We did deal with an extended Shigella outbreak a couple years ago in a preschool. It's really hard to get 3-year-olds to wash their hands correctly. It's just tough. So, and that is a disease that causes diarrhea, and it's very hard to get rid of. You can get it over and over again. So there's usually some outbreaks happening. It's just we're not always very public about it like we have been with COVID. So that division. And so the staff for that division would include the division manager that we're getting ready, that we are advertising now, a team leader, an epidemiologist, which is the position I would like to bring forward on Thursday, and then an administrative assistant. We may need 2 team leaders and 2 teams. I don't know yet. Right now I'm going to try for 1, but we may need the extra people. It's going to depend on the contact tracing company and how much they're able to handle. And so they're coming on board slowly, but they are coming on board. So, and then the contact tracers. So again, maybe 2 of those team leaders and then 3 to 5 contact tracers. Not just contact tracers, I call them that in here, but maybe also folks to help with vaccination, that kind of stuff. And these don't have to be nurses. They can be medical assistants, LPNs, social workers. You wouldn't believe all the different backgrounds our volunteers have that are doing contact tracing. Really, you just need to be a person who can talk to people, and you need to be somewhat inquisitive. You need to be curious and ask the right questions. And so it's more almost of a personality thing. But a medical background is helpful when you're asking about pre-existing conditions and answering questions. So that's what we're thinking for that. So that's all that we have for new positions that we are requesting in next year's budget and possibly starting this year. So any questions about that? Okay. So here's our 2021 budget request. For the 5th straight year, we are not asking for an increase in tax allocation. We can do it with what we have been receiving. I would ask that we don't cut the tax allocation because our state formula grant that we get from KDHE is dependent on that tax allocation. They use that to set the amount that we get. So we would also see a cut there if we did cut it. We are looking at about $800,000 more in grants. A decrease in program income that, depending on when we can get back to services, that could be low, but that's what we're guessing. And so almost $1 million increase in our total budget. And honestly, with the grants that we're looking at, it's probably low. We'll probably get more grants than when we did the budget, we didn't know like how much the grants would be. So we have another large one from the state we'll be bringing to you it's due at the end of the month, and it's $566,000?
No, I thought it was just 500,000.
Okay, 500,000 and some change. Yeah.
Are most of these grants matching, or are they just grants?
Nope, they're just grants. And that one that will,
Nice.
so the CARES Act, we have to spend through the end of the year. We only have till December 31st. The one we'll be bringing to you, we have till June of 2022 to spend. So yay, that'll help a lot. So we can finance this new division with that money.
Do they reimburse us on these grants, or is it just direct money coming in for whatever?
You know, I don't, some of them,
It
it's.
depends on the grant.
Yeah, it's part of the aid to local, which is through KHE. Some of those, they send us money up front, and then we send an affidavit, and some of it we get reimbursed, like WIC, which is not aid to local, but, did I explain that correctly? Okay. You have to come up if you're going to talk. Hop up here, you. Can't talk from back there.
Good morning, Commissioners. Edith Gaines, Finance Officer. So KDHE, for most of our aid to local grants, they do have a specific payment schedule that they send us the payments on, and then we do send in affidavits to justify how we spent the money or to get reimbursement if the prepayments haven't been quite enough.
Is there a lot of grant reporting after the fact that you have to do?
Well, there are quarterly narrative reports along with the financial affidavits that we submit.
All
Yes.
grants come with strings attached.
Yeah. Yes, they do.
Okay, well, thank you.
You're welcome.
Well, it's interesting you asked about the grant reporting, because, for instance, the maternal and child health grant has pages and pages of reporting we have to do. Immunizations has like, did you give shots? Yes. How many did you give? Okay. So it just depends on the department at KDHE how they require.
Linda, we've been able to use some of the health department reserves to do some outreach programs such as with Vallejo and some different projects we've got going on in Shawnee County. Where do we stand on our reserves going into 2021? Are we at our reserve level? Are we over our estimation? Are we looking at still having excess? I mean, because we were talking about at one point, we had quite a bit of excess reserves, and that's where we were able to do some partnership programs to kind of allocate some of those resources.
So right now, we are still not dipping into reserves, and we are still showing in the black for the year. I anticipate that to change, but again, with all these grants, I don't think we're going to be using reserves.
Well, I know that your
But
budget
argue with me, gals.
calls for you to increase the amount of reserves that you use.
Right.
I mean, your 2020 budget was a $400,000 allocation from reserves, and the 2021 is $547,000, so we're increasing almost $150,000, $146,000 from 2020 to 2021, so we're using more reserves, or projected to use more in 2021. I just didn't know where that put us overall with our anticipated amount that we have in reserves.
So I think it would still be fine if we did, we still have the reserves that we need to function as a health department. These were excess reserves. I don't think we're going to end up using, at least this year, we're not, because of the CARES Act money and the other money coming in.
I guess, how much money do we have in reserves? I should probably ask the question very.
Okay, I'm going to let them come up.
And I'll also make another comment, because in prior years, when they have projected to use reserves,
Right.
we have had such a difficult time hiring individuals
Right.
that we have not had to dip in reserves when when it's all said and done at the end of the year. We have not had to do that because we had empty, vacant positions. So in those prior years, we have not had to do that, even though it was budgeted to, because if those positions would have all been filled, we probably would have had to.
Sure.
Hi, Commissioners. Nancy Mitchell, Accountant 2 at the Health Department. When I was doing this budget, if we spent all of those reserves we budgeted for 2020 and all of the reserves we budgeted for 2021, we would be about at that, is it 20%, 15%? That it's 20%, that's our kind of goal to have. So we still have a lot of room before we're even reaching that goal point.
How much is that, though? And I guess
Like
I'm
2.5 million-ish.
All right.
Don't quote exactly that, but
no, I just
ish.
so that I have kind of
Yeah.
a rough.
So that 2.5 million is where we are now.
Sure.
Not I think our kind of goal is 1.5 million.
And I can get that information to
Sure.
each of you.
Again, just
over two.
as we're talking about 2021, and again, COVID has just, again, sucked the air out of almost every project that we had on our timeline and table for 2020, but maybe someday we can get our feet under us as far as COVID goes, and we can start engaging in some of those other projects that we had, such as addressing a food desert. If we wanted to be able to set up a pilot project and getting maybe some more farmers market, more SNAP funds accessible to North Topeka or into East Topeka, and kind of, again, establishing some pilot projects, I would seem to me that if we had reserves available, again, not subsidizing completely, but at least to help get it up and running
Yeah.
and viable,
That's the dream.
Thank you.
or establishing maybe a project with Parks and Recreation for more signage, more trail markers, more, making the trails more accessible.
And it's great to use that for match, to bring in some of those grants that we've had to pass on. I think the sky's the limit on what we could do. It's just having the time. And I'm grateful for the CARES Act and other money coming in, so we don't have to use our reserves for COVID. But we knew when we developed this grant, this budget, we didn't know how much we'd be getting. So the reserves were there for a rainy day, and it felt like it was pouring at that point.
And again, I look at some of the things that I always use Allen County as the example. Allen County did one project, and suddenly their rankings jumped significantly because of the number of people that it impacted. And it always just occurs to me that if we were to look at North Shawnee County, we really don't have any trails once you get north of the river. We have the walking trail around Shawnee North, but as we engage in the process of doing,
Violet Commons.
Rochester Road,
I-
yeah,
It's
I was
not
almost,
ours,
but it's
but-
not ours.
it's
But-
private.
But if we look at Rochester Road, we're going to be sometime in the next 10 years, redoing Rochester Road all the way from Walmart to 46th Street. As we do that, if we were to, again, put a trail or a walking path along that, that's gonna have a huge impact for a lot of people in North Shawnee County. Because again, there are not a lot of walking or biking trails available. And so again, if we have partnerships that we could engage with Department of Transportation and Parks and Rec and the Health Department, again, not the Health Department carrying the bulk of the water, but you might be able to do some of the amenities,
Right.
signs and markers and health hints and whatnot.
Oh, absolutely. I would be so excited to be doing those things, and that's where we want to go. So,
That's something that would go through the MTPO,
Mhm.
the Sharrows or whatever.
Yeah, but that's still a ways, that project is just even the Rochester Road is several years down the road.
It's part of the sales tax money, and it is down the road. I don't remember what year, but it's down the road a ways.
Okay.
But I just know that we always have just in preparation, you have years of advance before engineering and rights and easements and
yep.
before we start turning dirt.
Okay. All right. So, this budget also has 77.3 FTEs on the personnel budget. It was an 8.05 increase from the 2020 budget. And of course, that's mostly that new division that takes up that. Just briefly, here's a list of all of our major grants. There's a lot of them. And so we have an increase of we have $833,000 increase in grants. And these were the requests, correct? Yeah, these are the requests. We didn't get all that we asked for with aid to local. We usually don't, but we asked for what we think we're going to need. So WIC did have a fairly big increase because we increased the dietitian's salary. So they had about a $5 an hour increase in December of 2019. So that is reflected in the WIC grant increase. MCH, we received more. Medicaid match, our RN salaries increased, of course. The chronic disease risk reduction, Kansas Department of Health and Environment keeps asking us to increase this, so we added more staff time. So there were some increases there. So lots of grants. This is the aid to local award comparison. I will be bringing forward an item for just to accept the award amount to the commission. There's no new contract to sign this year. They didn't change any of the contractual requirements for this grant. So there was a big increase in state formula, and then the legislation took that back. So they gave it to us and they said, no, we're just kidding. So anyway, we're not getting that one. Childcare licensing to go up quite a bit. That really helps because we want to keep those folks, you know, keep their salary going. And that's an area of salaries that I do think needs to be addressed. Those salaries are some of the lowest as far as professional staff in the health department. The small increase in the chronic disease risk reduction. Family planning was quite a decrease because the first year was startup. We were supposed to be going, we were ready to start, and then COVID hit. And then we lost our APRN. So we are back to square one with family planning, and I hope we can get up off the ground soon. I just don't know when that's going to happen. And the need is still there, so we really want to do it. A small decrease in immunization action plan, that is a formula based on the number of children in poverty in your county, and then the public health emergency preparedness was a small increase. So even though this shows an increase of 17,000, we didn't really get that. We saw a decrease because the state formula was taken back. So maybe they'll restore it in the budget when they figure out what they're doing. So that would be great. I'd like to show a comparison of aid to local. You know, you hear us, I know you've heard Dr. Mazzino, you hear us say, well, public health has taken a lot of hits. And this just shows some of the hits that public health has taken in the state, because these are all state grants. And it doesn't include the family planning because that was such an outlier. So, and then it doesn't take into account the loss of administrative costs that we use for match requirements. So it's, you know, like to see it keep going back up, that's for sure. And then for our capital improvement, I love this picture, Be Wise, Immunize guy outside our building. The only thing that we really have on there is a roof for J.P. Lewis. I guess the roof was not replaced when we purchased the building. We've been able to patch it, and we'll just keep patching it as long as we can. We got a rough estimate that it would cost about $88,000 to replace that roof. And so Bill keeps working with us on patch until we can't anymore. And I don't think it's leaking right now, so that's good news. But we did put it in there just in case. So this is, I always like to show the budget comparison. Of course, you've seen the Shawnee County budget. Public health accounts for 7%, and that's more than just the health department. The health department budget is 6.9% from the total budget of Shawnee County, and our tax revenue is 2.7% of your total tax revenue. So we really are a pretty good bargain for you. And then the budgeted revenues, you can see we are 57% grant funded. So lots of grants to maneuver. And that is the last picture we had of our staff. We're going to have to update that, but we haven't been able to get together to do it. So hopefully we can in the next couple of years. So that's all I have. What other questions do you have for me or for our finance department folks?
Commissioner?
Yes.
As of December 31st of 2019 for our audit, it shows that the fund balance on a budget basis was $2,461,966, and on a GAAP basis was $2,502,727. So right at $2.5 million.
Good job, Nancy.
And that then equates to what percent of their overall budget? Their overall budget is $7 million, but that's.
And we'd like it to be at 20%. So that would be $1,400,000, $1,500,000.
So about $1 million over?
Probably about $1,500,000, so yeah.
Mm-hmm.
Yeah, so they're about $1 million over in their reserves. Again, not that we need to be just going willy-nilly, but at the
No.
same time, recognizing that there is a possibility for, if there's partnerships or some pilot programs or some special projects, we might be able to draw from that.
But I would say, I think COVID has really shown us how important those reserves are. because if we were going into this not having those kind of reserves and not knowing that we would be getting these grants that are now coming along, if the CARES Act had not been passed, if we had not been getting these other grants, we would be using these reserves and would be more than, probably certainly down to our 20%, if not more. So it really has shown how important it is to have these reserves and a little cushion.
Sure. It just, if we get to a spot where the roof has to be replaced, though, Betty, can they draw from their reserves to do that?
Yes.
Rather than having us use capital outlay or contingency funds?
Either way, it can be done either way.
I have a question about immunization for kids for school. At one time you said we're way behind on that because people have not been coming in for that. Are you seeing an uptick on that? Are they coming in now?
We're still not able to give immunizations because our staff's still tied up with COVID. So I still hope to get that fixed. That's still my plan. But really, I'm calling on our community partners to help us meet this goal. And honestly, Commissioner, we don't give that many shots anymore.
Okay.
I mean, probably there's people who can't get into their doctors and need us. That's the gap right now that we would probably want to fill. But our numbers, since H1N1, our immunization numbers have just really gone down.
Okay.
And I think it's because the doctors give them during your appointment. That makes sense. You're already there. Why not? I mean, so and our flu business has gone way down too since then. But this is a different year, and I'm sure the need's there. We're just trying to get our volunteers and our company up and running so we can move our nurses back into that work. But one of those nurses is going to retire, so.
Every year they talk about the flu that's coming in, and there's usually a flu shot of some sort. Are they talking about any kind of flu coming in this winter? Or
There will be flu. There is a flu shot. I don't know what the flu is going to look like yet. I mean, I think it's going to be really rough with the symptoms being similar in some ways and trying to figure out, do I have the flu? And the test is the same. You get that swab stuck down your nose for flu, so it's not very pleasant. But flu is not a reportable disease. They estimate that based on their formulas, so it's really hard to predict what we're going to see with flu. I'm not looking forward to it. Let me just say that.
I think the state's kind of falling down on reporting of flu. The way they do it, it's confusing with
Yeah.
with pneumonia.
It's just so, because flu is so pervasive, it's very hard to, if it was a reportable disease, that's all we'd be doing, like we're doing COVID. That's all we'd be doing is flu. So they really can't make it reportable because of the volume of flu we have. And in the past, it's like, well, you have these symptoms, you have the flu. Now we really can't say that.
Except if it was flu season, with all of the antibacterials and the spacing and the masks, who knows what our flu season's gonna look like? Again, I hope that we're not in that spot when it comes to flu season, but I think that, everything's overlapping between you look at the transmission of the flu and the transmission of other viruses. I mean, I don't know, it'll be interesting to see what the long-term impact is.
Masks would help with flu too. I'll just say that. And social
Let's
distancing.
not even go down that path.
I'm just making a fact there, sir. I'm not suggesting anything, just that is true. My grandchildren haven't had a sniffle since this started because they haven't been anywhere. So,
Yeah.
makes a difference. Other questions for us, other comments? Anything we can do better, different?
No.
I had a question. I know you said you're hiring another epidemiologist, was it?
I would like to, yes.
Do you think there's a market for them right now?
It's really tough. I know.
I think if I were an epidemiologist right now, I would be demanding a fortune. I mean, they're in pretty high demand.
They are. And so I'm going to ask Phil a second one, and I can't find the first one. I know that doesn't make much sense, but if we're going to have to go out and advertise again, I'd rather try to get two than just try this again later for the second one. I'm still optimistic we'll find a couple epidemiologists. I just don't want to increase the salary because we have other people on that salary range, and that starts becoming a matter of fairness that I can't really address. So I'm going to be optimistic. We're going to find a couple eppies. We're just going to keep trying. And we can advertise more widely. There's some things we could do maybe differently. It's just really hard right now, but I don't know what else to do. Try. I keep hoping somebody will get tired of where they're at and decide to want to come here.
Maybe. Good luck.
Thanks.
Well, and I think we've just got to really sell our great benefits.
Yes. And our great community. Anything else for me, or Edith or Nancy?
No, not for
I'm
me.
good.
No.
Thank you very much, Linda.
Thank you. Hope you have a great day.
You too.
Thanks.
All right.
Don't leave, Nancy.
What's the next one?
Next one is 11 o'clock extension.